We got a couple of things I want to talk about today. Of course, Muhammad Ali, the greatest, died the greatest. He was a wonderful ambassador for the United States, obviously, converted from a kind of a Southern Baptist religion to being a Muslim during the Vietnam War, and he won the Olympics and so forth. He just died at 74 of septic shock, which means the doctors probably gave him some intravenous or oral antibiotics to deal with an infection, and he died of shock because they killed so many bacteria at one time. When they die, they release all these toxins. It's like the old toxic shock syndrome for women, and the use of tampons and so forth. Same principle here. And a terrible, terrible loss that Muhammad Ali is gone. Of course, he had a long time suffering from Parkinson's disease, had lost his voice some years ago, and getting worse, 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 worse. And, of course, Parkinson's disease is an easy disease to actually prevent. It's an easy disease to deal with. I mean, I've treated many, I don't know, maybe dozens, close to maybe 100 people with Parkinson's disease. And if they do exactly as I tell them, get rid of the bad stuff, which drives the disease, and take all 90 essential nutrients to support maintenance repair, the brain wants to heal itself. The brain can repair itself. And I've taken really billionaires. One rich billionaire from Moose Jaw, Canada, by the name of David Dietrich, is no secret because we were dealing in front of huge crowds. David Dietrich had terrible, terrible advanced Parkinson's disease, and just in 90 days we were able to actually support and promote maintenance repair, where it was effectively clinically gone after just 90 days. And I think we could have done the same thing for Muhammad Ali, but we could never get close to him because of all his agents and so forth. Another thing I want to talk about, they have come out and said that Prince's death, the singer, was due to an overdose of fentanyl, a drug I'm very familiar with because of veterinary medicine. It's a veterinary drug. And, of course, it's tragic. When you look at all these entertainers who die of overdoses of drugs. And, of course, when Michael Jackson died, there was a hue and cry. Of course, Dr. Murray was put in jail, had his license taken away. But really, the one who should have gone to jail and had their license taken away was the nutritionist, his dietitian, who told Michael Jackson to eat lots of grains and whole grains, be kind of a vegetarian and vegan, just like Prince, because there's very little nutrition in these things anymore. And it's just tragic. Of course, Prince died at age 57. There's a wonderful article in today's USA Today. It says, so, once again, we're asking why, after all the alarm sounding for decades, why does this keep on happening? Why is there a straight line from Elvis Presley in 1977 to Michael Jackson in 2009 to Whitney Houston in 2012 to Prince in 2016? And what they're blaming is that because these people are famous and they want to get a drug for any reason, the doctors won't say no. And it's one of those things where that's not quite the answer. Remember, I'm a pathologist, comparative pathologist. I've been watching this for a long time, so I believe I know what's happening here. We just look at their little collage. They said here, clockwise from left, actor Heath Ledger died in 2008. Musician Jimi Hendrix died in 1970. Singer Amy Winehouse died in 2011. Actor Corey Monteith died in 2013. Comedian Chris Farley died in 1997. Actor Philip Seymour Hoffman died in 2014. All died of substance abuse. Well, I would guarantee you that all of them have a gluten intolerance. Two things are happening. Number one, they have an enormous amount of belly pain from the gluten intolerance, all the negative changes going on in their stomach and their intestines. Terrible, painful, and they want some pain relief. And then, because of the chronic effect, contact enteritis with people who are gluten intolerant, which is like 95% of Americans, they cannot absorb nutrients. And so they begin to get cravings. And if they latch on to something like soft drinks with lots of corn syrup in it, or candy bars, or whatever it might be, they have a lot of calories, they'll gain weight and become obese. But if they kind of trip on to, gosh, I can get pain relief from my arthritis in my hips and my terrible headaches and my belly aches by taking fentanyl mixed with cocaine and all this kind of stuff, they're going to be in trouble. Okay? Because the drugs can mask the pain, but they don't deal with the basic root cause of the problem. So I believe if you really look into the background, I've looked at people like Elvis Presley, of course, and Michael Jackson, and so on. Karen Carpenter. These people all died from complications of either directly from ruptured intestines, like Karen Carpenter, okay, and then people who die of things caused by malabsorption of gluten intolerance. Elvis Presley died of a cardiomyopathy heart attack. He was constipated all his life, definitely had a gluten intolerance. And Michael Jackson couldn't absorb the minerals that are necessary to make skin and hair color, so he had snow white hair. Yeah, the hair you were seeing him with the long curly hair was a wig because he had white hair. And he also had very, very pearly white skin. Started out as a very dark black kid for the Jackson 5. Couldn't absorb nutrients to make skin and hair color. Well, get a hold of the book Epigenetics, the book Dead Doctors Don't Lie, the CD Dead Doctors Don't Lie, the DVD Dead Doctors Don't Lie, and learn all of the secrets, how to avoid all this stuff. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a bit about Crohn's disease, as I've got a story that I got from CNN News headlined, Crohn's Disease Facts. Say, Crohn's disease inflames the bowels and symptoms that can come and go over a lifetime. Usually involves the small intestine, most often the lower part, the ileum. In some cases, the small and large intestines are infected. Affects men and women equally. Appears to run in some families. About 20% of people with Crohn's disease have a blood relative with some form of inflammatory bowel disease. Often have active inflammatory conditions elsewhere in their body, like joints, eyes, skin, liver, etc. There are many theories on what causes Crohn's disease. One suggests that it might be a virus or bacterium that affects the body's immune system and triggers an inflammatory reaction in the intestinal wall. I mean, they got so close there. A lot of evidence says that people with this disease have abnormalities in their immune system, not known whether the immune problems are a cause or a result. People with it are experiencing chronic abdominal pain, diarrhea, fever, weight loss, anemia. It should be examined for signs of Crohn's disease. In addition to a complete medical history and physical exam, they say stool culture checks for presence of abnormal bacterium, and a upper endoscopy allows the physician to examine the inside of the esophagus, stomach, and duodenum, and remove tissue or cells that are for further examination, like a biopsy. Colonoscopy allows a physician to view the entire length of the large intestine, looking for bleeding and ulcers and inflamed tissue. Upper GI examines the organs in the upper part of the digestive system. Lower GI examines the rectum and the large intestine. There's no cure for Crohn's disease, though. However, several methods are available to help control it. Treatment are to improve nutrition, another close one. Control inflammation, relieve abdominal pain, diarrhea, and rectal bleeding. May include drug therapy, anti-inflammatory medications, cortisone and steroids, and immune system suppressors, biologic therapies, antibiotics, anti-diarrhea, and fluid replacement, specialized diet. Oh, another close one. Nutritional supplements or surgery. And I'm sitting there thinking, I mean, it's related to the gluten intolerance thing, and they missed it by a mile.
Well, you're exactly right, Doug. It is caused by gluten intolerance, irritable bowel syndrome, inflammatory bowel disease, Crohn's disease, diverticulitis. Doctors want you to believe there's a wheat allergy involved. There's no allergy. It's actually a gluten intolerance, just like nobody has an allergy to poison ivy because there's no pollen and there's no nobody eats it. It kind of grows underground by spreading through the roots. And same thing is true with gluten. It's not a wheat allergy, but gluten is found in wheat, barley, rye, and oats. And so you had to avoid all those foods. Crohn's disease, we actually see so many cases of irritable bowel syndrome, inflammatory bowel disease, Crohn's disease, diverticulitis, things like colitis, ulcerative colitis, and appendicitis. These things are all a complex that goes along with a gluten intolerance. So the first thing I would do for these people with Crohn's disease is get them gluten-free, get them on the 90 cents of nutrients, and the body wants to heal itself. The intestines in an adult might take a couple of months to heal. In kids, it's less than that. The dramatic results in weeks, and you supplement with the 90. And we'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Okay, let's head to Illinois. And Dan, you're on with Dr. Wallach.
Well, Dan, you're on the air.
Hi there, good afternoon, Dr. Wallach.
Yes, sir.
I have a question. I was calling about my mom. She had, about a year, or almost 2 years ago, she had a heart attack and stroke due to blood clots. And she also has type 2 diabetes. So I was wondering, what would you recommend?
Okay, how old's your mom?
60.
Okay, she's 60 years old. What does she weigh?
She's overweight, at least by 100 pounds, I would say.
Okay, so she
I
weighs
don't know
200
exactly,
pounds?
but... No,
250?
I'm thinking she's at least 100 pounds. She's closer to 300, yeah.
Okay, so she's a big woman. How tall is she?
Yeah. 5'11".
Okay. Yeah, at 5'11", she could tolerate 185 pounds, maybe 200 if she works out. So she needs to lose maybe 100 to 120 pounds. She's 5'11". Mm-hmm. And so several things. Number one, she's got to get rid of all the bad stuff. None of this is genetic. It's all kind of self-inflicted nutritional deficiencies plus eating a lot of inflammatory things. So absolutely no fried foods. Absolutely no processed meats with nitrates and nitrites. It means no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, all that kind of stuff's got to go. No oils. It means no microwave popcorn, no theater popcorn, no olive oil, no coconut oil, no margarines, mayonnaise, celery, cooking oils, no soft drinks. Even the diet ones, you can't have those because it messes up mineral relationships and the carbonation, neutralizes stomach acid, all that kind of stuff. And then she needs to give up again olive oil, coconut oil, margarines, mayonnaise, celery, and cooking oils, and no gluten, no wheat, no barley, rye, oats. Just doing that alone will help her lose maybe 15, 20 pounds without trying real hard. But then you throw in the ASAP, and I'd like her to get 2 bottles of the ASAP, put a dropper full, not a drop, but a dropper full under her tongue, 30 minutes for each meal, a second dropper full under her tongue, 15 minutes for each meal, and after a couple of days, she'll start losing a half a pound to 2 pounds a day. Now, because she weighs 300 pounds, I'd want to dose her with what we call the healthy brain and heart pack, because she had a heart attack and a stroke. So I get her on optimally 3 healthy brain and heart packs per month, full dose for a breakfast, lunch, and dinner. If you can only afford 2, don't go any lower than 2 because you're not going to see much dramatic down at 1. And then I would also throw in the sweeties, 12 of those a day, 4 at breakfast, 4 at lunch, 4 at dinner. That's 3 bottles a month. Make sure she takes her fasting blood sugar before each meal. And as her blood sugar drops, and it will, she can reduce her medication slowly as her doctor has taught her to do. Call us every 2 weeks and let us know her blood pressure, let us know her weight, and let us know her blood sugar levels. We'll be back with Dead Doctors Don't Lie after these messages.
Let's head to Connecticut. And Dave, you're on with Dr. Wallach.
Hello, Dave, you're on the air.
Hello, Dr. Wallach. How are you today?
Okay, sir. How can we help you?
I would like to know if you have ever heard of somebody having constant adrenaline rushes, like throughout the day, maybe 40, 50 times a day.
Okay, how does that present itself in that individual?
The person is could just be thinking of something or something that has to happen later in the day, work, and they'll just get a spike of adrenaline just thinking about it. Or if something just minutely happens, they'll get a spike of adrenaline through their body.
Okay, and so when they get wait a minute. So when they get the spike of adrenaline running through their body, do they feel like running, pounding the wall? Do their heart get fast? I mean, what's happening?
It's basically they just, from what they explained to me, it was just they get a rush, they get that warm, tingly feeling right underneath their sternum, and that's it.
Okay.
And that's it.
Okay, well, it could be very interesting. You want to make sure and find out when these things happen. Do 80% of them occur 30 minutes after meals? Does 80% of them occur in the morning before breakfast? Do they occur in the afternoon before dinner? And so, they could be clustered at a certain time frame, so that's something. But let's kind of take them just at their word and what they're talking about here. But you said that, maybe later in the morning or later in the afternoon they would get these, thinking about something, get these adrenaline rushes. Well, this would be caused, and do they ever get drowsy after meals?
Not that I know of. I didn't really ask that question, but I will.
Yeah, you should. That's a very good question for people like this. At any rate, this could be something as simple as a change in their blood sugar. If they have a rapid drop in blood sugar because they have something what they would call in the old days narcolepsy, or today reactive hypoglycemia or hyperinsulinemia, it drastically affects blood sugar levels, which causes all these sort of anxiety attacks and panic attacks and what some people might describe as an adrenaline rush. And without blood tests before and after, there's no way you can actually say what that, if that's the case. But they do know that there's something dramatic happening on a regular basis. And so, first place you start is get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, and no carbonated drinks whatsoever, even ones you would consider benign, like club soda and sparkling water and ginger ale. Diet drinks, all that's got to go. And then, do you know how much this person weighs?
About 200 pounds.
Okay. And do they have any other issues, diabetes, high blood pressure, arthritis,
No, they're relatively healthy.
Okay. Well, what I would do is get them off all the bad stuff. And hang on, we'll be back. I'll give you the rest of the story here, Dave. But get them off all the bad stuff and get your pen and paper ready. We'll give you a protocol after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call the priority line, 831-685-1080, toll free 888-379-2552. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and the 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. That's toll-free, 1-888-379-2552. Okay. Again, I want you to think about all these natural disasters going on. We're talking about avalanches, hurricanes. We're talking about tornadoes, earthquakes, floods, wildfires, and then of course the grid goes down. Then from lack of maintenance, or you get somebody hacking it, and no electricity, no water and stuff. So you need to be prepared for these things. I want you to contact your Youngevity associate and ask for the book Prepare, and of course the subtitle is The Prepper's Survival Bible. The Prepper's Survival Bible tells you everything you need to do to put in your home, and so you will be prepared. Knowing where to go find something when an emergency does occur isn't good enough, because usually the bad boys will have been there and looted the place and burned everything down before you get there. So you need to have this stuff on hand. And again, the book Prepare, the subtitle is The Prepper's Survival Bible. Okay, Doug, let's go right back to Connecticut and Dave. Okay, so we got rid of all the bad stuff, and fried foods and processed meats and oils of gluten. And then what I would do is give this individual the Healthy Brain and Heart Pack, 2 of those a month, full dose of everything at breakfast and dinner. Okay, so it's 2 Healthy Brain and Heart Packs per month. Then I also give them the Synaptive, so the brain is functioning properly and metabolism of the brain is working properly. And this gives you the raw materials to have the brain, the neurons, make the biochemistry that's necessary for one nerve cell to talk to another. And that's called Synaptive. And then I would also get the D-stress capsules, capital D like David-stress, capital D like David-stress, and then go ahead and take 3 of those twice a day. It's 2 bottles a month. That's for the metabolism of the brain. And keep good notes about the time these things occur and so forth, and attach the occurrence with eating some food and so forth. Obviously, some things you can eliminate very quickly. Other things you might want to check that out. And I think that's where we want to start. Go ahead and do those things, and then give me a call in 2 weeks and 4 weeks and 6 weeks. Let me know how it's going. Okay, Doug, let's go to callers.
All right, let's head to Canada. And Sheila, you're on with Dr. Wallach.
Hello, Sheila. You're on the air.
Yes. How are you today, Dr. Wallach?
Okay, thank you. How can I help you?
Yes, I had seen you on Benny Hinn, and anyway, to make a long story short, I had called the number, and Ken Anderson had called me back, and I started on the starter pack because I explained some problems that I had, because I did have breast cancer, and I had 3 surgeries with a partial mastectomy, and radiation, 16 treatments of radiation, okay? So, and then, of course, I'm sore, and I've, even before this, I had my bones and muscles and so on, was sore even before the surgery.
Sure.
And
okay, let me ask you something here. Do you have any other issues? Do you have any, like high blood pressure, diabetes, arthritis, anything like that?
Well, I did with the arthritis, and they told me that the radiation did affect my body. I guess it increased it because my fingers started to go, some crooked and bumps and whatnot.
Sure. Okay, what do you weigh? What do you weigh, Sheila?
Oh, 165, 170 in that area.
And how tall are you?
Oh, about 5'2". I've shrunk, I guess, a half inch. I was 5'2" and a half, and 5'2".
Okay. And so your main complaint is
about the radiation as well. Like now, they told me it would take 2 years. It'll be 5 years this October that I've found out about the the cancer issue,
Sure.
and
Okay, you have your pen and paper? You have your pen and paper?
I do.
Okay. All right. 165 pounds. What I want you to do is get rid of all the bad stuff. No fried food, no processed meats or nitrates or nitrites. Means no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef. All that's going to go. No oils, no microwave popcorn, no theater popcorn, no olive oil, no coconut oil, no margarines, mayonnaise, salt-dried cooking oils, and no gluten, no wheat, no barley, rye, no oats. Everybody in the household, including the dog, the cat, the bird, the fish, man, mother-in-law, renters, everybody's got to be gluten-free for this to work. Then, at 165 pounds, I'd have you take 2 of the Healthy Brain and Heart packs per month, 2 Healthy Brain and Heart packs per month, and then I would add 2 large bottles of glucogel. So you can take 15 of those glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, and all that combination of the 2 Healthy Brain and Heart packs per month and the 2 large 240 count bottles of glucogel are designed to support and promote healthy and functional metabolism, a healthy and functional immune system, and which is one of your best friends when you have cancer, and also to support and promote healthy maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae, and so forth. And then, because you have a history of cancer, would also take, if you prefer liquids, you can have 2 ounces a day of the Z radical, ounce at breakfast, ounce at dinner. It's designed to, again, support the immune system when you have serious diseases. And lastly, you can either take the triple treat chocolate, 6 of those a day, or the Cell Shield RTQ, 6 of those a day, 3 at breakfast or dinner, because either way, you're going to get enough ORAC points, enough antioxidant points to support your immune system and help you deal with all these problems you've got. Now, one last thing I throw in for the radiation, we have a wonderful detox you can take every day, and it's called Herbal Rainforest. It has 14 classic cleansing herbs, including Cascara Sagrada and Taraxacum. Wonderful product. Tastes like peaches. Kids love it. Go ahead and start taking a tablespoon, which is a half ounce at bedtime, with a glass of water, so that 1 quart's going to last you 2 months at this rate. You start out with a full ounce at bedtime, you might get diarrhea, so let's start out with a tablespoon and a half ounce per day, and if you don't after 2 weeks, you might want to try moving up and see how that works for you. And let's see here. That's kind of where I would go, because, again, we're dealing with the radiation, we're dealing with the arthritis, we're dealing with just your general needs. We're going to stop the bad foods, which actually drive cancer, and it can contribute to the cause of it. So give us a call every couple of weeks. Let us know how you're doing. If you have any questions, you can call anytime. Certainly want to hear from you after you visit your doctor each time, and let us know what the doctor says about whether your cancer has come back or you have advancing other problems. Okay? And so we'll walk you through this. Okay, Doug, we got time to start another one here?
Yeah, we sure do. Let's head to Las Vegas, Nevada. And Allie, you're on with Dr. Wallach.
Well, Allie, you're on the air.
Hi, Dr. Wallach. Thanks for taking
Hi.
my call.
You bet.
I'm calling regarding my sister-in-law and brother-in-law's 10-week-old puppy. It's 3.5 pounds and has a herniated disc. And he was originally he couldn't bark and wasn't able to stand. They gave him prednisone and some other things and have him immobilized, and he can bark and he can stand. And I'm just wondering what supplements we can give this little guy to help him recover.
Okay, so he's 3.5 pounds.
Mm-hmm.
What's the breed, do you know?
It's Shih Tzu Poodle mix.
Okay. Okay. And he's an adult, right?
No, he's a puppy, 10 weeks old.
Okay, 10 weeks. Okay, there we go. All right. And so what I would do, of course, is make sure that it's, at this point, at 3.5 pounds, I would get him a gluten-free dog food. You got to read the labels, particularly in dry dog food, that is totally gluten-free, and it's designed for toy dogs under the 10 pounds of body weight. And hang on, I'll give you a supplement protocol after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And, Doug, let's go right back to Nevada and Allie. Let's see here. Okay, we got rid of all the bad stuff. Make sure it's a gluten-free dog food designed for toy dogs under 10 pounds of body weight. And then I would also give the dog 3 of the glucogel a day to support maintenance repair of those discs between the vertebrae and the cartilage and ligaments in the spine. The fact that the puppy is showing improvement is a very good sign. And I would also give it a half a scoop of the Arthrodex, 1/2 a scoop of Arthrodex per day. So you can put a quarter of a scoop at breakfast and a quarter of a scoop at dinner. It's a powder, a little crystal. And then I would also throw in the EFA pluses. Go ahead, give it 2 of those a day, 1 at breakfast, 1 at dinner time. You can puncture the EFA plus and squirt it on the dog food, or put it, down the little puppy's throat, rub his throat, and he'll swallow it. And that's going to give him the essential nutrients necessary to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, and so on. Give us a call in a couple of weeks. Let us know how puppy's doing. Okay, Doug, let's go to caller.
All right, let's head to Texas. And Lexi, you're on with Dr. Wallach.
Well, Lexi, you're on the air.
Hi, Dr. Wallach. Thanks for taking my call.
You bet. What's up?
I have 2 people that I wanted to ask you about.
Well, we'll probably only have time for one. So you may have to call me tomorrow for the second one.
I can do that.
Okay.
The first person is my friend who is 61 years old. She was just diagnosed with chronic lymphocytic leukemia. She has hypothyroidism and acid reflux as well.
Okay, so low thyroid and reflux. Mm-hmm. How much does she weigh?
200 pounds.
And how tall is she?
About 5'8".
All right, so at 5'8", I'd like to see her weigh 165, so she needs to lose 35, 40 pounds. So let's get going here. Got to get rid of all the bad stuff, because obviously leukemia is a potentially life-threatening problem here. And so we need to get her off all the bad stuff that will drive the cancer. Absolutely no fried foods, no processed meats with nitrates and nitrites. It means the deli slices and sandwich meats and so on. Absolutely no oils, no olive oil, coconut oil, margarines, mayonnaise, salted cooking oils, or microwave popcorn or theater popcorn. No gluten, no wheat, no barley, rye, and oats. And then at 200 pounds, I give her 2 packs a month of what we call the healthy brain and heart pack per month. That's the quickest way to say all that. 2 healthy brain and heart packs per month, a full dose of everything twice a day, full dose of breakfast, full dose of dinner time. And then for specifically to support the immune system here, I'd have her take 3 of the Ocean's Gold twice a day. That's 2 bottles a month for the sea cucumber that's in there. It's legendary for supporting the immune system when one has bad disease, including cancer. Then I would also throw in the Beyond Tangerine, this BTT, Beyond Tangerine 2.0 tablets, and they're designed to support, again, the immune system by raising ORAC points. So at 200 pounds, I'd have her get 1 bottle a month. She can take 2 of those BTT 2.0 tablets, 2 at breakfast, 2 at dinner time. And then for, let's see here, the reflux, I'd have her get the ultimate enzymes, not any enzymes, the ultimate enzymes, because it does have stomach acid in it. And when you get reflux, this means you don't have enough stomach acid. Your stomach's not sterile anymore, and yeast and bacteria grow there. And every time you eat carbohydrates or sugars, or even fiber sometimes, they will ferment the carbohydrate, sugars, and connective tissue, fiber from plants, and that will make gas and cause reflux. So give me a call tomorrow. We'll go over this one again in some more detail. But that's where I would go, and get her off all the bad stuff and give us a call, and we'll go through the second one. Well, thank you, everybody. Really great testimonies and questions today. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order. PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Longevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the ultimate tangy tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Longevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the ultimate tangy tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities. If you're up several times every night to go to the bathroom, have frequent urination during the day, feel like you have to urinate but then have difficulty getting a stream going, have leaking, dribbling, or urgency to the point a restroom must always be nearby, you may have an enlarged prostate. According to the National Kidney Foundation, by age 60, more than half of all men have an enlarged prostate, or BPH. By age 85, that number is 90%. According to the American Urological Association. Ultimate ProstFX from Youngevity has been developed for nutritional support of the prostate gland. ProstFX promotes prostate health and supports healthy prostate function. Stop sprinting to the restroom and avoid those embarrassing moments with ProstFX from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate and don't forget to ask about home-based business opportunities.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I got to tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Youngevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.